Hey guys, how are you today? Dr. Stroud with Cornerstone's Animal Tip of the Week for you today. So I'm outside because it's gorgeous and also because we're going to talk about allergies. And there's grass, there's trees, there's all kinds of things that can cause allergies. You know it, I know it. We're all having things we're doing allergy medications for. And guess what? Our pets can have allergies too. So let's talk about them. We'll talk about dogs first. What do you do for dogs with allergies? How do you even know if your dogs have allergies? And so one of the common things that can result in allergies are the same things that can result in allergies for you and me. And so the grass, trees, food can certainly cause allergies. We don't typically see food allergies as often as we see environmental allergies, things like dust. So I'm very allergic to dust. Our dogs and our cats can be allergic to dust too. Okay, the difference is though that intrinsically their allergies are a little bit different, and so where you and I we breathe in it and it gets into our respiratory system and we end up with kind of a sinus headaches or kind of congestion and we sneeze and all the other watery eyes. Yes, our pets can get that too, but they tend to have more of a problem with their skin. Okay, and so what happens is their skin cells should fit together like a puzzle. Okay, just like a perfect puzzle. But when they have underlying allergies, their skin cells, their puzzle pieces don't fit together right. And so that ends up being there's breakage or a skin barrier problem, which means that all those allergies, all those pollens that can cause inflammation get down underneath the skin level where they don't belong. And so oftentimes with skin allergies or allergies in dogs in general, or cats, even cats too, will end up with them, having itchy skin. And when they have itchy skin, that makes them more predisposed to having other infections come in and cause a problem because there's more inflammation in the skin. So yeast and bacteria can then get in the skin. Other things, a very, very common thing I see here in Missouri that we as owners don't typically think about, but you guys need to know, is that licking the paws. Okay, dogs should not be licking their paws. If they are licking their paws, there's a problem. Okay, and so whether that be behavior because there's something else going on, or whether it be that there are underlying allergies, the reason they lick their paws needs to be evaluated. So if you have a pet that's licking skin or scratching or just even licking their paws every once in a while, that would be cause for evaluation, and I would definitely recommend you getting into your veterinarian and having that evaluated. Okay, I often get asked, can I give my pets antihistamines, so Benadryl or Zyrtec or Claritin? The answer to that is it depends on the patient. Many patients don't respond to antihistamines like you and I do. Not only can Benadryl kind of knock them out with some patients, not every patient, but some patients, but they don't respond the same because they don't have the same type of histamine response. And so we have to use other medications that actually affect the pathology or the way the allergies work. So getting down at that skin receptor level. And that's why antihistamines or things like Benadryl don't always work, is because they work in a completely different way than the way they need to work. Okay, and so if you, again, clinical signs for you to watch for: if your dog is scratching, if your dog is shaking its head, if your dog is licking at a particular skin region, or if they're licking or chewing on their paws. Those are all signs that your pet may have allergies and needs to be evaluated. How about cats? So cats will naturally groom themselves and will lick themselves. And so how do you tell a difference? The way you tell a difference is if you are seeing them lick in a specific place excessively. That would be one way. Certainly cats tend to lose their hair in places where they're having problems and tend to just be itchy all over. Again, that would be signs of allergies and that you need to have that evaluated. So that kind of sums it up as far as clinical signs. What can you do about it? There's lots of things you can do about it. Anything from having them on a sensitive skin and food diet, to adding omega fatty acids, to different medications. It's going to depend on your pet's health which one of those choices you should make, though. And so anytime that you think your pet has potential to have allergies or is having any conditions where they're scratching or licking or chewing, you need to have them evaluated by your primary veterinarian so that they can determine exactly what's going on, because there are other things that can cause those same clinical signs other than just allergies. And you don't want to be giving your pet unnecessary medications that could potentially result in the skin not clearing up in the first place. So definitely always consult with your veterinarian, and then they can get you on the right track and be able to tell you whether omega fatty acids or a special diet or something along those lines may help your pet. So if you have any questions, feel free to drop them below. As always, thank you for watching, and we'll see you next week. Bye.